You probably have seen the first video, which is more about the assessment process. This second video is about the steps that we take after you have been diagnosed. Clearly, when we diagnose you as having ADHD, we discuss the implication, and then if you decide to undergo treatment, we will explain to you what the titration is. Often I have found that patients forget what we explain because there's a plethora of information that we provide to you, and sometimes it's not easy to remember all of that. That's why I have prepared this video. So what happens is once you decided to go on the treatment, we have to start you on what is known as a titration process. The titration involves starting you on a small dose of medication and working it up step by step to the appropriate level of medication or maintenance dose. So this usually takes 4 to 5 weeks. If it is straightforward, it takes 4 weeks. Sometimes it can take longer. The whole purpose of titration is to find the right dose for you and also the right medication. Sometimes we start you on a particular medication, let's say for example methylphenidate, and that doesn't work, we will have to switch it to some other medication like lisdexamfetamine. So the titration ideally should take about 4 weeks, but sometimes it can take longer. At the end of this titration process, we will have a mandatory follow-up appointment. The other thing I have to say about the titration process is it's a two-way process where you are given feedback forms on a weekly basis, which you will fill and send it back to us so that the doctor and the patient is liaising with one another during that process. And the feedback form has things like your pulse, your blood pressure, your weight, your side effects, any progress that you have made, and any other comments you want to make. One thing I have to say is right before you start the titration process, you have to have your pulse, blood pressure, and weight done before we can actually prescribe you medication. So once the titration is complete, you will have what is known as a mandatory follow-up, and at the mandatory follow-up, we will decide that you have reached a maintenance dose, and we will write to your GP and ask him or her to enter what is known as a shared care agreement. Now, a shared care agreement is a contract between your GP and us, where the GP essentially takes over the repeat prescription. This saves you a lot of money because you don't have to have private prescriptions. And perhaps a word or two about private prescriptions. If a private prescription is given to you, you not only have to pay for the script, which costs about £28, but also the retail price when you go to the pharmacist. So if you are lucky enough to have the shared care agreement with your GP, you don't have to pay for any of this. You will pay £9.15 or whatever it is these days for an NHS prescription. We can't promise you that your GP will agree for a shared care agreement, but what we can do is try our best to get you that shared care agreement, saving a huge amount of cost. I hope that explains everything. The other thing I have to say is you will still probably have some doubts. You can always email one of us. Our emails are provided when at the end of the assessment, we will give you a document which has the emails of each one of us and also our admin and support staff. I hope you have enjoyed and learned something from this video. If you have any further queries, please don't hesitate to contact us. Thank you for watching the video.